So in the previous class we have just discussed about the absorption, right? And with the absorption, like what are the different kinds of absorption, like how the drug will be absorbed. Either it is simple absorption, that is through the simple diffusion, or is it through the active transport, or is it using any carrier related proteins, or if at all there could be any exocytosis or endocytotic processes occurring. Okay, so for the drug to get absorbed, that is to get transported. Okay, and so we just had an idea about it, and now we in today's class we'll be just discussing about the different factors. Okay, so the factors that will be affecting the absorption, whether they will be enhancing, like what are the different factors that will be enhancing or declining the rate of absorption of the drug. Okay, so out of all those, the first main factor is the disintegration and dissolution time. So we know that disintegration, it is nothing but making the particles into smaller one. Okay, so a large particle size, it will be deemed down to smaller particles. Okay, so that disintegration as well as dissolution. Dissolution is nothing but where the drug, it gets dissolved within the body compartments, that is within the body fluids. Okay, so here whenever we take any drug, okay, so it has to first break down. Okay, and then that breakdown, it has to occur within small particles. Okay, so then those particles, they will get absorbed. Okay, and then they will get dissolved. Okay, so that dissolution will be within the gastrointestinal fluids. Okay, so the first one is disintegration and the later one is dissolution. So this disintegration and dissolution, they will also be acknowledging, that is they will also be causing a sort of changes within the rate of absorption. So we have just discussed about the oral route. If at all we take through the subcutaneous or intramuscular route or any other parenteral route, so what will happen is, without the process of disintegration, that is the particle, they doesn't need to get dissolved. Okay, so that is they doesn't need to get break down. Okay, so they can directly dissolve into the tissues. Okay, so whatever the tissues or fluids we are being taken through the intramuscular route or through any other parenteral route, they will get absorbed faster compared with that of the solids. Okay, so this is about the disintegration and dissolution time, where if at all any sort of delay occurs within the disintegration and dissolution time, it will finally affect the absorption. And next one is the formulation. So for a drug to get combined, okay, so that is a drug to achieve out as a final product, we will not only be mixing the active ingredient, and we will also be adding few excipients or few inert substances or inactive substances, just like here we are using diluents, or you could go for binders or any disintegrating agents. Okay, so those all will be the other formulation factors. Okay, so what these formulations will be doing out is, they could at times interfere with the absorption, that is they may either delay the absorption or they may faster the absorption. Okay, so that is the rate of extent, it will also be depending upon the formulation. And next is particle size. So it is very simple that if at all the particle size is small, then it is way easier for it to get absorbed within the body. If at all it is having a large particle size, it has to break down and then it has to get absorbed. So the time for breaking down, it will be taking much time, and if at all we are giving only smaller size of the particles, then they can easily go out through the body, that is they can get absorbed from our body. Okay, so mostly the drugs like the corticosteroids, griseofulvin, digoxin, aspirin and tolbutamide. Okay, so they will be absorbed well whenever they are given in the form of smaller particles. Okay, and next is the lipid solubility. So we all know that the lipid soluble drugs, they get absorbed faster, okay, compared with the water soluble drugs. The reason here is because the cell membrane, it is made up of the phospholipids, so it will be easier for the lipid soluble drugs to go and adhere there and then get absorbed, whereas compared with the water soluble drugs, so the water soluble drugs, they cannot easily pass through the phospholipids of the cell membrane because of the opposite nature. Okay, so the lipid solubility, it will also be promoting out for the rate of absorption. Okay, it will also be affecting the rate of absorption. And next is its pH and ionization. So most of the drugs, if at all they are in the unionized state, so being in the unionized state, they get absorbed faster compared with that of the ionized state. Okay, so because the ionized drugs, they are mostly lipid soluble and they can be well absorbed. So here are the drugs where, for example, the acidic drugs, they remain unionized in the acidic medium, that is nothing but mostly within the stomach region. So most of the acidic drugs, just like aspirin or barbiturates, they get absorbed, that is they get remain in the unionized state. Okay, so being in the unionized state, so they can be like within the acidic region of the stomach, so they can remain in the unionized state and they can get absorbed. And next, coming to the basic drugs. Okay, so most of the basic drugs, they remain unionized within the alkaline medium, that is nothing but the intestine. Okay, so within the intestine, most of the basic drugs, they remain unionized, and thus if at all they are being unionized means there is chances of being absorption, that is the rate of absorption will be faster. So the examples here could be pethidine and ephedrine. And if at all we go out for strong acidic or strong basic drugs, so they will be in the ionized state. Okay, so because of being in the ionized state, the absorption will be poor. So the examples here includes heparin and streptomycin, the drugs which are strongly acidic or strongly basic drugs. Okay, and next factor considering is its area and vascularity of the absorbing surface. So it is simple, if at all the absorbing area is more, so the absorption will be obviously or simultaneously more. Okay, so the simple one, the larger the surface area, so it will be having a more vascularity and it will be showing a better chance for absorption. Okay, and because compared with the within the GIT, so the absorption, okay, so that is the vascularity of the small intestine. Okay, that is the absorption area of the small intestine is more, and hence here most of the drugs, they get absorbed within the small intestine region. And next, the gastrointestinal motility, that is nothing but the movement of drug. Okay, so within the GIT, or you can also call the gastric emptying, that is the drug passing from the GIT into the other areas. Okay, so that is nothing but the gastric emptying. Okay, so this gastric emptying is nothing but where the drug, it will be passing from the GIT into the intestines. Okay, so it will be, if at all the gastric emptying time is quicker, then it can easily reach the intestines, and if it is reaching the intestines faster, so the absorption rate will also be faster. Okay, but there are cases where the intestinal motility, just in case of any diarrhea condition. Okay, so within the diarrhea condition, what will happen is the motility or the movement within the intestines, okay, so it will be faster. So if the movement within the intestine is being faster, then the drug cannot get absorbed, right? So the drug absorption here will be reduced. Okay, and next is with the presence of food, where food could also alter the absorption rate. So just like the examples like tetracyclines or chelates, so what they will be causing out is they could interfere with the calcium products within our food, just like the dairy products. So what they will be forming out is they will be forming the chelates, and they will reduce or delay the absorption time. Okay, so that is with the presence of the food. And next is with the metabolism. So there are chances where the drugs, they could get metabolized within, or they get degraded within the stomach itself without being causing the absorption. So there are chances where few drugs, they could get degraded within the stomach itself. So the drugs like riboflavin or nitroglycerin. Okay, and next is the diseased condition, where at times of any intestinal diseases like malabsorption or achlorhydria, that is the increased hydrogen content. Okay, so H plus ions secretion, if at all it is being increased, so what it will be causing out is, so it will be directly altering the absorption of the drugs, where the absorption, it will be reduced. Okay, and apart from it, the other main factor is the first pass metabolism, which we have already discussed, where the first pass metabolism, it is nothing but the passage of the drug, okay, that is from the site of absorption to the systemic circulation. Okay, so here generally we can also call it as the pre-systemic metabolism. Okay, that is before reaching the systemic circulation. So what will happen is, there are chances where the drug, it will get metabolized. Okay, So here whenever the common thing we know, if we take through the oral route, so there are chances where the drugs it will get metabolized within the liver or within the gastrointestinal tract before reaching the systemic circulation. So we know that whenever we take a drug, it has to get absorbed and then reach into the systemic circulation. But here what will happen up is few drugs they'll get metabolized, like before reaching the systemic circulation itself, they'll get metabolized within the liver. Okay. And this first pass metabolism, it will be differing from drug to drug as well as from person to person. This might get differed. Okay, so where it could cause either partial or total inactivation of the drug. If at all it is causing any partial inactivation of the drug, then there are chances where we can just increase the dosage of the drug and we can give out the drug. But the better way is we will be just changing out the route of administration. Okay, so that is apart from giving the oral route, we could give out the drug through other routes like a parenteral or transdermal routes. Okay, and the next one is the bioavailability. So bioavailability, it is nothing but the fraction of the drug that will be reaching the systemic circulation, and that is, it could be from the any route. Okay, so where the administration, it could be through any route, that is either you can take it from the oral route or you can take it from the intravenous route. So the route, it could be anything, but where the drug, okay, that is the fraction of the drug that will be reaching the systemic circulation. Okay, so we will be counting it as the bioavailability of the drug. Okay, so the reason or the importance of this bioavailability is we will be just comparing the drugs. Okay, so that is the drugs which are given through the intravenous route, we will be comparing the plasma levels through the non-intravenous route. Okay, so because we know that the intravenous bioavailability is simply nothing but the amount of the drug that will be reaching out your systemic circulation. Okay, so that systemic circulation generally for the intravenous route, it is generally 100%. Okay, so for intravenous route, the bioavailability will be 100%. So we will be checking out this bioavailability with the non-intravenous routes. Okay, so we will be just checking out the drug doses through the non-intravenous routes, and we will be just comparing the plasma levels of the drug, that is in which route we have taken, and we will be just comparing it with the intravenous route, because here within the intravenous route, the drug, it will rapidly enter into the systemic circulation, where we have said the bioavailability could be 100%. Okay, and next is bioequivalence. Bioequivalence is nothing but we will be just comparing the bioavailability of the different formulations, that is of a same drug. Either it is paracetamol, just assume we are taking paracetamol, we will be comparing it through the different routes, that is we will be comparing paracetamol, that is the time of absorption of paracetamol through the intravenous route, and then comparing the time of absorption of paracetamol through the oral route. Okay, so that is same drug in different formulations. Okay, through different formulations we will be just comparing it, that is nothing but the bioequivalence. Now we will have a look with the bioavailability. Okay, so whenever we have given a drug, so either it could be in the form of tablet or it could be in the form of a injection. Okay, so we will be just comparing the plasma concentration of the drug with the time, how much time it has taken. Okay, so if you just observe the graph, okay, so here the time, okay, that is taken for the plasma drug to reach within the systemic circulation. Okay, so it is generally linear. Okay, so this is the drug injected. Okay, so whereas if at all the drug is taken through the oral route, okay, so where it will be showing out a steep. Okay, so that is flat surface will be generally seen. Okay, that is bioavailability is nothing but we are comparing the area under the curve. Okay, so the area under the curve which is through the oral route by the area under the curve through the IV route. Okay, where we will be dividing it by 100, then we will be getting the total bioavailability of the drug. Okay, so that is about the drug absorption. We have just completed the absorption and the different factors, and now we will be going out with the drug distribution. So drug distribution is nothing but the reversible. Okay, so when a drug, it reversibly leaves the bloodstream and then it will be entering out into the interstitium or into the different cells. Okay, so that process is nothing but the drug distribution. So here we are telling the term reversible here. Okay, so the reversible is either it will go and it could come back. Okay, So the drug, once it has get absorbed, it will be reaching out into the systemic circulation. Okay, either it could be that is generally reversible way. So where from the systemic circulation it could enter into the interstitial fluids and then into the cells or the tissues. Okay, so there are different factors which will be contributing for the drug distribution. Okay, so the first one is the blood flow, and next comes the capillaries. Okay, so the extent of the capillaries, and next the bindings. Okay, the binding to the plasma as well as to the tissues. Okay, so first if you observe the blood flow, generally the blood flow, it will be different for different organs. So depending upon the cardiac output, so not all the organs they will be getting equal amounts of the drug. Okay, so the drug distribution, it will generally get varied. So for suppose there are higher areas, okay, higher organs where the blood flow will be generally high, just for example the brain, liver and the kidney. Okay, so they will be receiving a greater extent of the blood compared with that of the adipose tissue, right? So here the blood flow, it generally varies. Okay, so depending upon the variation, the drug distribution will also be varied. Okay, and next is with the capillary permeability. So capillary permeability is nothing but, so we have just now said the organs, right? So the higher organs are the liver and the brain, right? So within the liver also we will be having a sort of variation, because within the liver what will happen is, either within the liver or spleen, what will happen is it will be having out the basement membrane, right? So within this basement membrane they will be having discontinuous capillaries. Okay, so within this discontinuous capillaries, so the plasma proteins they can pass. Okay, so that is within the liver. And next coming in the case of, so while we discuss it in the case of brain, what will happen is the capillaries here, they are generally continuous. Okay, so if they are continuous, and thus they will be forming a blood brain barrier. Okay, so now what will happen is, whenever the drug it will be entering out the brain, okay, so the drugs they have to pass through these endothelial cells. Okay, so within this endothelial cells, either they can pass normally or through the active transport. Okay, so the drugs could pass. If at all we take it through the lipid, if at all we consider the lipid soluble drugs, okay, so most of the lipid soluble drugs they can easily penetrate within the CNS, because they can easily dissolve within the endothelial cells. Okay, but whereas coming to the water soluble drugs, they cannot easily penetrate within the endothelial cells, because the continuation here, that is because it generally forms a tight bond. Okay, so the basement membrane, if at all it is generally formed in a tighter way. So the lipid soluble drugs being lipid, and this layer, this membrane is also, this basement membrane is also being of lipid layer, so they can easily penetrate. But in case of the water soluble drugs, what will happen is, this being continuous and there is no slits or pores present in it, so the drugs cannot easily pass. The drugs are nothing but the water soluble drugs, they cannot easily pass through the CNS membranes. Okay, and next is the drug binding. Okay, so the drug binding within the plasma proteins or within the tissue proteins, what could be the variation? Okay, so if we consider the plasma protein, so here what will happen is the same, the reversible binding of the drug to the plasma proteins, it will be generally, so because of the reversible binding, what will happen is the drugs they will generally get sequestered. Sequestered is nothing but they will just hide up themselves. Okay, once the drug is being distributed, so what it will be doing out is, either it will go and bind or hide within the non-diffusible forms. Just as a non-diffusible form, all the drug they will get sequestered or bind up within the various compartments. Okay, so where the transfer, so once the drug is being bind, okay, so what will happen out is, now the drug will not be easy, like the drug is not completely available now. Okay, it has just bound up. Okay, so whatever this bound drug is being present, so it will get slowly released. Okay, once the free drug, okay, that is the free drug is being eliminated out, then whatever the bound drug is present to the protein, it will get slowly detached, and then it will be entering into the other vascular compartments. Okay, So here generally for the plasma proteins it will be having albumin. Okay, so where albumin, it is the major drug binding site. This albumin, it is a plasma protein where this is a like it will be acting as a major drug reservoir. Okay, where most of the drugs they will be binding out. And apart from albumin you will be also having glycoproteins, and you will be also having lipoproteins, and also this is alpha acid. Okay, lipoproteins and globulins. Okay, so these are the different drug binding sites or the proteins that are generally present, where albumin in a higher content it is generally present, where most of the drugs they will be binding out to albumin. And further, this albumin it will be having 4 different sites. Okay, site for warfarin, diazepam, okay, digitoxin, okay, and also it will be having for tamoxifen. Okay, so those are the 4 different binding sites. 4 different binding sites could be present of. Okay, so that is within the plasma binding. And next, coming to the tissue binding. Okay, so here what will happen is most of the drugs they could bind up to the tissues. Okay, so where the higher concentration of the drug it will be presented within the tissues than within the extracellular fluid and with the blood. Okay, and next the drugs here they are getting accumulated because they are being binded. Okay. And next important factor is within the distribution is nothing but the volume of distribution. Volume of distribution, it is simply nothing but the hypothetical volume of the body fluids. Okay, so within our body we will be having out the different body fluids, right? So the hypothetical volume of the body fluids in which the drug may get distributed, that is simply nothing but the volume of distribution. Okay, so a volume of distribution, it is nothing but the fluid volume which will be required, or it will be containing the entire drug within the body. Okay, and at the same time we'll be just measuring out within the plasma. So if you want to calculate the volume of distribution, VD, it is nothing but the amount of drug that is present in the body by the total plasma concentration. Okay, so this plasma concentration at a time 0 which we will be considering. Okay, so that is the volume of distribution. Once the drug it enters into the body, so what will happen is it has to get distributed into the 3 different compartments. So the 3 different compartments within the body, or either they can hide out within the cellular site. Okay, within the cell gap itself they could get hide out. Okay, so the different compartments include plasma proteins. Okay, so that is plasma, interstitial fluid. Okay, and also the extracellular fluid, that is the total body volume. Okay, so within these compartments the drug they will get, and they will get once they get distributed, so they will be just entering out into the different body compartments. So firstly we will be discussing about the plasma compartment. Okay, so if at all we just consider a drug, it is having a larger molecular weight, then what will happen out is they can easily bind out within the plasma proteins. Okay, so whatever the large molecules that are being present, so they will just move out through the endothelial junctions within the capillaries and also within the plasma. Okay, so the plasma proteins, generally the larger molecular weights, they will be just binding out within the plasma proteins. And next, coming to the extracellular fluid, and so within the extracellular fluid what will happen is the lower molecular weights drug, okay, they will be generally binding, and within the lower molecular weight, more specifically the hydrophilic drugs. The hydrophilic drugs, they will be just entering and they will be moving out through the slit junctions of the capillaries. Okay, so because the higher hydrophilic drugs they cannot cross through the lipid membrane, and they will be entering into the water layers of the cell. Okay, so these drugs generally they will be distributing within the volume, where the plasma water and within the interstitial fluid, that is by the sum of the plasma water and within the interstitial fluid, they will be just distributing up. Okay, and this will be constituting of around 20% of the total body weight. 20% is nothing but where you can consider the extracellular fluid as either 12 to 14 liters in an individual weighing about 70 kgs. Okay, so that is within the extracellular fluid. And next, if we compare with the total body water, okay, so in the previous one we have just said that the plasma, where it will be binding up with the larger molecules, and next is the extracellular fluid, where the drugs, they will be binding out to the low molecular weight but which are generally hydrophilic. But here the drug, they will be having a lower molecular weight and they will be generally hydrophobic. So this hydrophobic drugs, they will be moving into the interstitium, okay, and within the slit junctions, and then they will be reaching out into the intracellular fluid. Okay, so now the total body volume is, it will be constituting of 60% of the total body volume, with around 42 liters, okay, around 42 liters of the of a person weighing around 70 kgs. Okay, so these are the different junctions. Okay, so that is, this is the intracellular fluid, which will be ranging from around 24 to 28 liters, okay, and interstitial fluid from around 12 to 14 liters, okay, and next plasma around 4 to 6 liters, where the total, it will be accounting out for 42 liters generally within a 70 kgs of the individual. Okay, so here the same plasma for the for the drugs which are having a larger molecular weight. Okay, and next, within the extracellular fluid for the drugs which are having low molecular weight and which could be moving out within the endothelial or slit or within the interstitial water. Okay, and total body weight, where here also the same low molecular weight molecules, which drugs which are of hydrophobic in nature. Okay, so within this, the drugs, they will get dispensed out, or sorry, they could get distributed out.